We have been a long-term pioneer in nationally around healthy homes, and we have pioneered that work as a triad of community-based organizations. So Esperanza is an organization that is actually a community builder with an unusual health capacity. We partner with SAGE, Strategic Actions for a Just Economy, as our partner in community organizing, and their focus is on tenants' rights and economic justice. Our lead in this ASHHI project is St. John's Well Child and Family Center, which is a network of FQHC community clinics with a very, very progressive orientation. This combination of healthcare, provision of direct services, the promotoras who are doing the health and housing surveys and production work, combined with the policy work and the tenants' rights advocacy from SAGE, is the model that we have been moving forward and that the ASHHI grant has helped us to advance. Esperanza's model, without having any specific production dollars, has always been a model that has focused on an intervention almost exclusively based on iterative education with families within their homes and making behavioral transformations with them that way. By having a production budget and the encouragement to leverage more dollars for actually producing improvements in the home, we've been able to match the in-home interventions with actual material improvements in the home, which has been represented quite a change and has helped us to leverage new partnerships that we haven't had before. In and around our collaborative through the ASHHI grant, we are doing a number of very, very important changes as it relates to the policy landscape. We are participating in a statewide working group around integrated pest management. We have a Los Angeles group working with we call it the bed bug working group, that we're working on looking for solutions that can help us produce a blame-free bed bug intervention and protocols that we can get the landlords and tenants and legislators to agree on. What is evident in our particular collaborative is that everything we have done historically and moving forward has been a very collaborative process. So this is another chapter in which we get to experience the development of even more partnerships than we've had before, to leverage new working relationships, both in the political arena and with other community-based organizations. One of the most extraordinary examples I think we have had in the production side is a particular housing situation that one of our young promotoras went into and discovered almost inhabitable circumstances that a family was living in, where there were a tremendous number of code violations way beyond any one entity's production budget. I mean, it would take maybe $60,000 or more to bring the building up to code. But working collaboratively to really understand that the number one thing that needed to be done to prevent the risk of a catastrophic emergency was to replace the boiler in this home. So we have done a whole boiler replacement, which was an expensive but relatively modest repair, which makes it possible for the family to live in this place long enough for us to try to leverage other dollars that can help to remediate the problem. I think that my partners and I would agree that any great city has a stable rental population, and we are all committed to human rights in our particular collaborative, and consider that our folks have a right to housing and access to health and well-being, and we're all committed to fighting for that and also joining other people into our collaborative.